side story. Joint commitment to establish scientific evidence-based strategies to overcome challenges on drug trafficking and abuse. The problem of drug trafficking and abuse has increased significantly, thus becoming a serious national crisis, severely affecting almost every sector. The rapidly emerging drug-related threats and devastating adverse consequences, such as deaths due to overdose, drug-related illnesses, permanent physical and emotional damage, directly affect the health and welfare of the people and also heavily strains the healthcare systems. Moreover, it threatens the socio-economic development of the country due to loss of productivity, increase in crime rate, and the overburdening of the criminal justice system are the other adverse consequences. Further, the rapid global manufacture of drugs, expansion of the southern supply route, drug-related transnational organized crime threaten the security, stability, and sovereignty of the country, as well as other countries in the region. Despite many interventions to curb the rising drug problems, emerging trends display a further deterioration of the system. For instance, the emergence of new psychoactive substances, NPS, as legal alternatives to controlled drugs, which are mostly targeted at children and youth, has highly toxic and fatal effects. Furthermore, they can be easily purchased through social media and delivered to particular addresses through postal and courier services. Diversion of pharmaceutical drugs into the illicit drug market is also an emerging critical issue. In terms of the international drug control treaties to which Sri Lanka is signatory, we are obliged to take necessary actions to control the situation. Hence, we emphasize that there is a need to revisit the current policy framework and identify critical deficiencies in order to effectively address the emerging threats, their devastating consequences, and to protect the youth, children, women, and communities. Undoubtedly, scientific evidence is inevitable in formulating comprehensive, balanced, coordinated strategies to combat illicit drug trafficking and abuse. Scientific evidence is vital for intelligence, investigations, and operational activities of law enforcement agencies, for the criminal justice system to overcome emerging challenges, and also for prevention, treatment, and rehabilitation measures. The drug problem cannot be tackled in isolation. The ultimate goal is to establish an integrated, multidisciplinary, mutually reinforcing, balanced, coordinated, scientific evidence-based, and comprehensive approach within the national drug control system with the stakeholders. The National Dangerous Drugs Control Board, established under the NDDCB Act No. 11 of 1984 under the purview of the Ministry of Law and Order and Public Administration and Management, is the national focal point for the prevention and control of drug abuse in Sri Lanka. It is responsible for drug policy making, advice, making recommendations to the government on such policy, and coordinating all national and international drug-related agencies for drug prevention and control. The NDDCB is fully engaged in strengthening responses, working closely with stakeholders to combat the emerging drug-related threats. While realizing the importance of science in drug policy making, the National Narcotics Laboratory was established by the National Dangerous Drugs Control Board in 1990 through the combined funding and technical assistance of the United Nations Drugs Control Program, UNDCP, WHO, and the Sri Lanka government. It was established as an impartial unit to generate scientific evidences and their dissemination for effective drug supply control and demand reduction measures in Sri Lanka. It follows a policy of providing high-quality laboratory and scientific services to the relevant authorities and customers. The Narcotics Laboratory also aims to promote scientific services, data and information generated through laboratory analysis and scientific research for supply control, drug law enforcement, and demand reduction, prevention, treatment, and rehabilitation measures. It aims to improve scientific capacity and capabilities to ensure healthy lives and peaceful societies free from drug abuse. What we do: scientific evidence-based operations and investigations, scientific intelligence services, scientific evidence-based strategic interventions, policy and decision-making, promote scientific-based standards and best practices, and scientific consultancy services. The staff at the National Narcotics Laboratory works together to achieve the vision and mission of the National Dangerous Drugs Control Board, and also the ultimate goal of the government of the Democratic Socialist Republic of Sri Lanka: to eradicate the drug menace from our country.